Hello and a very warm welcome to Rajya Sabha Television. You're watching The Big Picture with me, Frank Rausam Pereira. Well, terming the right to health as a fundamental right which includes affordable treatment, the Supreme Court on Friday said that it is the duty of the state to make provisions for affordable treatment during this unprecedented pandemic. Right to health is a fundamental right guaranteed under Article 21 of the Constitution of India. Right to health includes affordable treatment. Therefore, it is the duty upon the state to make provisions for affordable treatment, the court said. A three-judge bench of Justices Ashok Bhushan, R. Subhash Reddy and M.R. Shah had taken up the issue of healthcare during the time of the pandemic on its own and also looked at instances where bodies of coronavirus casualties were not handled with dignity. The top court asked the government to devise a mechanism to give rotational breaks to doctors and healthcare professionals working continuously since April as well. On behalf of the Centre, Solicitor General Tushar Mehta assured the court that the government would take a decision soon. The court also directed the authorities to conduct more testing and to declare correct facts and figures. In this edition of The Big Picture, we will analyse the observation of the Supreme Court on affordable healthcare. Joining me on the program today are Professor N.K. Ganguly, former Director General, Indian Council of Medical Research, Urvasi Prasad, Public Policy Specialist, Niti Aayog, and Devender Singh Rana, Chairman, Board of Management, Gangaram Hospital. Thank you to my guests for joining me on this edition of The Big Picture. Professor Ganguly, let me begin the program with you first. You know, this issue of affordable healthcare is not a new one. It is something that has been, discussed thoroughly for several years now. What is, the crux of the problem? What is the fundamental issue really?
Actually, affordable healthcare, there is no doubt that affordable healthcare is a fundamental right of everyone. The universal health coverage is also a UN resolution which every country need to provide. However, in our country, there is a problem about the insurance. Like very few people, very small percentage of people are covered by insurance. For very poor, the government has created a plan where about 5 lakh rupees insurance, they are covered with that. So here the issue comes that when a disaster comes like this pandemic, what we need to do. So what Supreme Court has said that talk to the hospitals and the healthcare people and do a public-private partnership. So this is very, very important part of that judgment. What happens that in NCR area, there are 4 governments, the Delhi government, Haryana government, UP government and federal government. And Rajasthan government also comes in some fashion or other. So there need to be uniformity everywhere. And in this uniformity, the hospitals need to really function not only for COVID patients, but for other patients also, because there are cancer patients, there are neurologic disorders, there are many patients who actually die if they don't get a health cover. So private hospitals have to do a balance on that. And they need to, in this balance, they need to also provide the quality care because they are either NABH accredited or JCI accredited. They can't bring down the quality. Some of the hospitals had to actually cover 50% of their bed for COVID, and Dr. Rana is here. One time he had to cover 80% for the COVID. Along with that, certain percentage of free beds which you have to provide. So hospitals are actually collapsing. Many of the hospitals have been sold to international runners from Malaysia, Singapore and others. Every hospital need to make at least 50% of above the cost so that it can maintain its infrastructure and others. Hospitals are struggling to pay their doctors. Their doctors are actually in a great distress. They are going through tremendous distress. So what I understand, because they have to do sometimes 48 hours duty, the residents and others, and they will collapse. And if we provide them holidays as it has been stated, we have to hire more, and there is no hiring at the moment happening. So what I visualize here, that what Supreme Court has said to government, that set up a public-private partnership. It should talk to the hospital managements. We have, luckily in your panel, we have Dr. Rana, who is a very efficient chairman of a very efficient and a traditional hospital, which is dedicated to service. And he will be able to tell you exactly how this hospital, which is a charitable hospital, not profit hospital, that is struggling to survive at this given moment.
Right.
So at this given moment, what I will suggest and end, that there need to be a conversation with the hospitals. And in this conversation, if there is a need to subsidize the hospitals, government should subsidize.
Okay. Dr. Rana, what is the biggest challenge that private hospitals are facing, that hospitals generally, the healthcare system as a whole is facing right now?
It is theoretically you're right, and Supreme Court is also right, that it is the duty of the state to provide quality healthcare to all citizens of the country or nation, But I think we have failed during the last more than 70 years, and now the present government is doing its best to provide some relief by creating Ayushman Bharat. Talking of pandemic, this is a different situation, and where I think every state government and central government is striving their best, I can say, right now to provide help to everybody whosoever is suffering. So there is only what I can hear, that I don't know what Supreme Court judgment and all those things, but I just say, okay, doctors should be, there is no doubt that doctors are fatigued, both in government sector and private sector. The question of giving them relief and hiring more doctors, from where will you bring doctors? There are no doctors available who can be hired actually. There are not adequate number of doctors in the country who can be hired. So that question, I don't think that will rise. How will we give relief to some doctors and hire more doctors? You can hire only if they are available. That is number one. Number two comes to that affordability. And if you're asking only about this pandemic, then of course government is providing free and they're trying their best. And they're asking, as far as Delhi is concerned, in NCR, the government of Delhi has asked various hospitals to reserve certain beds to all sections of society. And that they're also trying to provide, but as Professor Ganguly told, that the government had to be aware that you require at least bottom line to run the hospital. If you are going below the bottom line, then we will not be able to sustain for a long time. Fortunately, if the pandemic is coming down now, maybe situation will improve, but if such situation continues, and if we keep, say, 80% bed reserved for this thing or 60% beds, then you cannot continue for a longer time. But I hope that as far as Delhi is concerned, all hospitals cooperative with the government, and as far as citizens of Delhi are concerned, they are getting best care as far as possible. That's my view.
Okay, Urvashi Prasad, let me go back to a point that Professor Ganguly was making in his opening remark about, uniformity and ensuring that each one of us gets, quality healthcare at the end of the day. How do we ensure uniformity as far as hospitals or the healthcare system as a whole is concerned?
Yeah, so this is a much broader issue that has been raised by the Supreme Court. And of course, it's sort of the holy grail when we look at healthcare. Universal health coverage is really where we are trying to move towards. Now, there are a few dimensions to this. One, of course, is the preventive and primary healthcare, and you would see the government has launched the health and wellness centers under Ayushman Bharat. The other is your hospital-based care, your secondary and tertiary care. And as mentioned, we have the Pradhan Mantri Jan Arogya Yojana, which has been launched. Now, of course, it's important to note that at this point, this covers the poorest population. There are talks that we might need to expand the coverage of this insurance because there are many people in the country who might not be poor, sort of in the strict sense of the term, but they are still vulnerable. So it's often referred to as the missing middle. These are people who are not covered with any health insurance cover at this point. So we might, of course, need to expand the gamut of insurance. And the third part is the actual quality of the services. And this includes not just the physical infrastructure, but most importantly, the human resource. Because you can build the physical infrastructure quite quickly. You can create a bed, an ICU bed, a hospital bed. But if you don't have the trained personnel to operate it, you're going to struggle. So that is really, these are some longer term issues that we are grappling with. Now, of course, in the pandemic, the government has tried to do whatever we can because it's a very crisis situation. It's a short term situation. And so here, through public-private partnerships, through partnerships with charitable hospitals, through corporate social responsibility, a number of cities and states have come up with innovations to try and bridge this gap. Even on testing, you would have seen that in many states, progressively, the costs have been brought down. But these are sort of patchwork solutions that we've had to do in a short period of time. Ultimately, we need to undertake these longer-term, systemic, much harder to do reforms if we are to really fulfill the mandate in the true sense, in the way the Supreme Court has put it.
Absolutely. Oh, absolutely. Taking the discussion forward, Professor Ganguly, since we are here, the general public believes or has a strong feeling that hospitals, private hospitals, some of the best hospitals in the country charge exorbitantly, and they believe that there should be some kind of curb as far as the charges are concerned. On the other hand, we have you yourself as well as the one member on the panel who's part of the private hospitals, has said that they're struggling to survive. So what's the middle ground there? How do we thread this thin line?
Actually, government has been trying this for a very pretty longish time. They have created rule for the drug prices, pharmacies, for the devices, for many things. They have set prices where there could have been overcharge. However, otherwise there is very little scope for overcharging things in the hospitals, because the doctors' salaries have to be paid. Whatever are their salaries, they are actually driven by the market forces. The nurses' salaries, the other infrastructure in the hospital, they have a cost. So government has already done this. It should do auditing so that the padding of the bills doesn't happen. And I can assure you in Gangaram, it doesn't happen. Actually, I have a good knowledge about this hospital because I am part of the research department. There is absolutely no padding of any kind. So, however, there is a cost. Like if a patient is in ICUs, many of the COVID patients who go to hospital go to ICUs. ICU have a huge cost. It is 24/7 attended. There are machines, there are other things which are needed there. And hence that cost cannot be really reduced any further. So what I suggest that what we do, that we create in the pandemic situation, we allow the corporate social responsibility funds, which cannot be used in the healthcare. If there is a healthcare organization, this should be allowed to be subsidize some of the facilities in the healthcare. Other corporate social responsibility funds should be moved towards healthcare, because if we move it towards healthcare, at least in the pandemic, this will benefit people. Thirdly, we could also ask the foundations, the Tata Foundation and other foundations, to support healthcare during the pandemic time, and Pradhan Mantri Yojana and other yojanas which are being accumulated through donation. It should support the private healthcare systems, so that the private healthcare system should come up with this. They have a desire. It is not that they don't want it. And the doctors also are dedicated for service. They don't want to fleece. They don't want to really pad the bills, at least not for pandemic arena. So in this situation, the best is that we get the best financial people on board and try to find out a mechanism in which the hospitals need to survive. At this given moment, the hospitals income above the cost has come down to 5%. They, in this money you can't survive because there are wear and tear, there are infrastructure costs, there are increase in the salaries, etc., which happen yearly. Nobody is actually increasing the salary anymore. In Gangaram they don't deduct money from the salaries, but other hospitals are deducting money from the salaries.
Right.
So in this situation, in this stress, the people are working. So we need to bring on the best economists, best financial guys, the banks, and some or other to make the hospitals survive. This will and also improve the infrastructure in the government hospitals to a state in which all the citizens, whether they are moneyed people or they are poor people, they can go to government hospitals also, and they choose voluntarily the government hospitals.
Absolutely. All right. So, Dr. Anna, there's a lack of trust really as far as the public is concerned with regards to private hospitals. They believe that they unnecessarily fleece them. So how do we ensure that the public, or how do the hospitals regain the trust of the public? And how is there a scenario or is there a way that you see where we can reduce the costs as well as not compromise with the quality?
Frank, give me 2 minutes to clarify everything. It is state's duty to give quality health care. Quality health care requires, as she told, that it requires buildings, it requires equipment. Probably this can be provided very easily in private sector by citizens. As far as government is concerned, through exchequer, they are creating such institutes, and they can create physical infrastructure. And as far as equipment is concerned, ultimately question comes on manpower, and manpower, there is a shortage of doctors and also paramedical staffs, and that is going on for last 70 years or more than 70 years, and we have not able to meet the standards. And our biggest problem right now is that accessibility is not a question of money only. In very accessibility of good quality healthcare in the rural India, where 70% population living, is a primary health care can be given, that is only pure state government, and that is being given, that is also not given the best. But to whatever extent we have progressed during the last 70 years, I cannot say that that is the best, but we have to achieve primary health care. Once we provide good primary health care, probably the secondary disease, especially this metabolic disease, the incidence will go down, And I think as for coming to know private health sector, you asked that the policing, I can't understand public, The public feels that, I can talk of my hospital first, that here is a hospital which is run on no profit, no this loss basis. No trustee takes even a cup of tea from the hospital. Everything, whatever surplus we get, that is flowed back in the hospital to give a quality health care. After quality, going to cost, whether it comes to the exchequer or whether citizens give and pay to private hospital. So no private hospital. Let us say our hospital, it is being run by trust, So trust is not taking money. Let us say we take another corporate hospital. They are investing money. You can have some pragmatic cost, and you will then realize that they are not fleecing actually. It's the one who is investing money in our hospital, public money which is invested, so we are not making any money. If somebody is investing from the pocket, they will have right to earn also. Similarly, doctor working in a private hospital, like any other citizen, they have got right to earn more money. That is why they are working here, So it is not like this, And I can't understand, if they feel that private hospitals are fleecing the money, why don't they go to public-run hospitals? Even in the corona times, and I don't think that there is a good facility. So they don't have, they feel the private hospitals are fleecing, but at the same time, they don't have any faith at all in public sector hospitals, In public health sector hospitals, that is the crux of the problem. That is the bigger crux, That is a bigger problem. After all, private hospital is a creation of few, say, relatively well-off people, those who are giving money from the public, and then they're creating facility for themselves. Public hospital, they are being created out of exchequer. and our own money. That is not free. People feel that like All India Institute or any bigger hospital, they are getting free treatment. This is not free treatment for at all. Why doesn't your media stress on the people that everything is paid, whether in private or private, this government, The government is getting money very easily through exchequer. Private hospital is direct payment by the private people. And we are crumbling that system also. So we have to see, you can pragmatically do the costing. And the government is, of course, taking some steps that they are trying to, curb the prices on the that margins on the drugs. That should have been done much earlier. That is being done after 50 years. Even now, today also, I feel that we have still failed to create, curtail the prices of drugs. We must fix up MRPs. And abnormal MRPs around the drugs. Why their abnormal MRPs are still existing, So there are a lot of issues which require in-depth study. And to just say that private hospitals are fleecing money, I say this is absolutely wrong. And if they are fleecing money, who is compelling them to go to private hospital? Why don't they go to government hospital? Why don't they go to All India Institute of Medical Sciences, which is lying vacant in Corona period, So we have to understand that all these things. Public has to understand, public needs to educate it. It is only free socialist people, they will make a noise in order to get the care. They want to have private care in the private hospital, but at free. Who is going to pay money? Somebody got to pay.
Let me take the points that you're making forward with Urvashi Prasad now, So Urvashi Prasad, as far as, this particular situation is concerned, at some level, there's a thought process that says that we need to improve the infrastructure, the public healthcare infrastructure, and hospitals run by the state need to be improved and need to be brought to a level where the people have trust in public healthcare as well. So how do we do that?
Yes, so I think, it's very important for us, and hopefully after this pandemic, we will truly realize and reorient our health system towards public and preventive care. We have been a very cure-focused health system historically, and that is simply not feasible at the kind of scale that we need to operate. We have too many people, we have too many diseases to contend with. We cannot push everyone into hospitals. No matter how good and how many hospitals we build, it will result in too much cost escalation, and it's not even the right way to go about it. So we really need to focus on preventive and public health, and that, of course, is primarily the responsibility of the government, and that's true for governments across the world. Then we also need to rebuild, as you said, this faith in the public sector, because while the public sector might be there in various parts of the country because of the quality of services, and of course, to a large extent, this depends on the human resource capability. We have massive shortages, we have quality issues. So we need to address these and rebuild that faith in the public health system. But also we must make use of our private sector. Of course, India has a large private sector in health, and I'm not talking of just the organized large hospitals in the metro cities, but we also need to partner with private sector and expand the reach of services into our tier 2 and tier 3 cities, towns, villages, because that is where the access is needed. It's not enough to expand insurance coverage. If people don't know where to use those vouchers that they have, where to get healthcare access, then it will not serve the purpose. So I think we need to invest in these areas as we move ahead from here. Of course, immediately we need to come up with some creative solutions because we're dealing with a pandemic situation. We also have a large burden of non-COVID health services which have suffered, and we need to sort of cover up those as well. But in the longer term, we must seriously undertake some of these reforms, not just in infrastructure, but human resource capacity, as well as public-private partnerships, and really go forward with a system of trust, which is a fundamental issue in the entire healthcare system.
Absolutely. All right. Since we are here, then let's get quick closing comments from all my panelists with the best way forward. I've got limited time, so I'm going to ask you to be brief, starting first with you, Professor Ganguly.
What I will say that we need to get, at the moment, only 2 vaccines are in the market in the developed world. These are Pfizer and Moderna. Moderna vaccine can be brought in for our healthcare workers. It got cleared today. It doesn't require that kind of ultra cold chain. I will suggest that all our healthcare workers should be provided vaccination, and all our senior citizens with comorbidities should be provided vaccination forthwith. then other vaccines will come up, and all the others who are in the line will get it. So my suggestion is that we do it, and we provide ramped up real good diagnostic services. The home diagnostic has just come out. There are some other better diagnostic platforms which have been available. These two things we should do, so that, and the public health awareness, as Urvashi ji was saying, this will reduce the burden from the end. We should, every one of us, and your news channel, please bring up the trust of the people to the hospitals. Not all private hospitals are fleecing. Actually, no hospital wants to fleece. And so this particular idea should be removed from the head of the people. They should see hospitals as service centers who serve people.
Right. All right. And Dr. Rana.
Yeah, number one intake, that all state governments should put their best on primary prevention care or primary health care. That is the most important, so that the incidence of disease goes down. As far as secondary and tertiary care hospitals are concerned, I think let the government hospital have faith of people that they are also capable of providing health care, and let people not have this idea that private hospitals are fleecing. They must understand that you require money to give to ultimately at the end of the day to provide health care. And of course, I think that the most important thing is that still we are ignoring the rural population. The rural population must, we are all talking of this pandemic in cities and everywhere. And I have an idea that in the rural area, NGO-run hospitals or by some small hospital should be supported by all tertiary care hospitals as situated in the bigger cities.
Okay, all right. And Urvashi Prasad, close the show for us with your concluding remarks.
Yes, so I think in the immediate term, of course, we need to do whatever we can to expand access to services as we have. We have public-private partnership models. We need to try and use CSR if we can more creatively. And of course, we need to focus on the non-COVID health services as well, where we do have some catching up to do because of the lockdown and the several months post that. So that's one piece of it. But in the slightly longer term, we must really invest in public health in a very, very focused manner. And that should be one of our biggest takeaways from this pandemic. And of course, human resources as well, along with expanding access to services in the smaller cities, towns, and villages, very much in partnership with the private sector as well.
All right. On that note, then, I'll call it a wrap on this edition of The Big Picture. Thank you to all my guests for joining me on the program and putting things into perspective for us. What's coming out of this discussion is that the government is doing its part to ensure that everyone has access to quality healthcare. The Ayushman Bharat scheme covers the poorest of the poor, and the government is looking to widen the scope of coverage to ensure that all vulnerable sections are covered. We need to improve infrastructure in government hospitals and rebuild faith of the people in the public-run healthcare system. Also, we need to have creative solutions in place and work towards ensuring that people don't need to go to hospitals in the first place. That is, ensure that we improve public healthcare as a whole, and we need to invest in public health and ensure that we invest in human resources as well going forward. And hopefully, the pandemic has taught us to do just that. With that, it's a wrap. See you again next time.